Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show, bringing you another fascinating guest who is involved in creating a better tomorrow, not just for us, but for all our companion animal friends out there as well. We have the honor today of being joined by Dr. Nicole Ehrhart, who is the director of the Columbine Health Systems Center for Healthy Aging at Colorado State University, where she leads an interdisciplinary research effort to identify basic as well as translational mechanisms that ultimately help promote healthy aging. Dr. Ehrhart holds the Ross M. Wilkins M.D. Limb Preservation Foundation University Chair in Musculoskeletal Oncology and Biology. She's board-certified veterinary surgeon, professor of surgical oncology in the Department of Clinical Sciences in the College of Veterinary Medicine and Biomedical Sciences, and a research faculty member at Colorado State University's Flint Animal Cancer Center. In Dr. Ehrhart's research lab, the Laboratory of Comparative Musculoskeletal Oncology and Traumatology, she conducts research in a variety of areas, including translational aging, limb preservation, tissue engineering, and sarcoma research, as well as bone and muscle regenerative medicine to ultimately benefit human and canine patients. Dr. Ehrhart also holds joint faculty positions in the School of Biomedical Engineering, the Cell and Molecular Biology program, the Gates Regenerative Medicine Center at University of Colorado, and the University of Colorado Cancer Center. And in addition to her research, she's held leadership positions in national and international organizations, including the American College of Veterinary Surgeons, Veterinary Society for Surgical Oncology as president, Veterinary Orthopedic Society as president, and chair of the World Veterinary Orthopedic Congress Committee. We're honored to have with us today a lot to talk about. Dr. Nicole Ehrhart, thank you so much for taking the time to go on the show.
Thank you, Ira. It's an honor to be here.
It's great to have you, Nicole. I would love to start off, as we typically do, by handing you the floor for a little bit, just to talk a little bit more about you and your background. Tell us for a couple minutes, what got you into veterinary medicine at the beginning that started this amazing journey of yours?
Sure. Yeah, as far as I can remember back, I wanted to be a veterinarian since I was a child. And as I progressed through my primary education and then into my undergraduate career, I really was interested in the aspects of surgery itself. And so in vet school, that is pretty much what I thought I would do, and actually went on to get a surgical residency. And during that surgical residency, I was pretty sure I would be an orthopedic surgeon and go into private practice and kind of do a lot of surgery. And that was the extent of my, career aspirations at the time. And a really interesting thing happened that completely impacted my research trajectory, because I was asked to volunteer during my surgery residency. I was asked to be a volunteer at a children's cancer camp. And when I went there, I met a little girl named Jenny, and she was 9 years old, and she was on chemo, so she had no hair. But what struck me about her is she was an osteosarcoma survivor, and she had just had an amputation. And so as a veterinarian, and especially a veterinary surgeon, osteosarcoma was a disease that was unfortunately near and dear to my heart. It impacts a lot of animals, especially dogs. And we were, doing a lot of work in limb salvage. So where we spare the leg or actually reconstruct the limb so that the animal doesn't have to have an amputation. And here was this little girl standing in front of me with an amputation. And it occurred to me that there's got to be some connection here. And of course, as we now know, osteosarcoma is essentially identical in humans and dogs, biologically, molecularly, microscopically, and responds to similar types of treatments. And that was kind of when the light bulb went off, that translation between human diseases that also occur in animals and veterinary medicine, and how much of an impact we could have. And honestly, as a surgeon, I was thinking, well, gosh, we've got to have better solutions so kids don't have to have amputations. And maybe that avenue to find those solutions might be through our companion dogs, wherein we could find, discoveries that might help them live better, longer lives with all of their limbs, and then be able to translate that to people. And so that was really what ignited the passion for translational research early in my career. And that's kind of what launched me into sort of the regenerative medicine, limb preservation kind of world. From there, I spent a lot of years doing a lot of stem cell work and, bone substitute work and tissue engineering. And then in 2018, I did sabbatical and learned a little bit more about muscle. I was looking into muscle stem cells to try to regenerate muscle tissue in patients that had large defects of muscle, whether that was from cancer or trauma or infection. And really, again, one of those moments where the light bulb went off, that stem cells and our regenerative capacity to, create new bone or new muscle in defects that were really large is very limited. We're not salamanders, we can't regrow a limb. As a higher mammal, we have a limited regenerative capacity. But the other thing that occurred to me at the time is that's sort of what happens as we age as well, that our regenerative capacity begins to get less and less robust as we age, and our stem cells get depleted, and they also get exhausted, and they get senescent. And that was when I realized, expanding the scope of what I was working on in tissue regeneration to maybe thinking about it more broadly from an aging perspective was a really exciting field. And it coincided with a time when, the biology of aging and understanding the fundamental drivers of aging was really coming into the mainstream of science. And so that was the tipping point once again for me. And that's why I lead this translational research center in aging now.
Awesome. And yeah, so it's interesting. You started publishing back in the sort of mid 1990s on some of your work in limb preservation and osteosarcoma. You make this fascinating dog-human sort of comparative biology connection. And then I also found it interesting, and then we'll get into the regenerative medicine in a bit, but one other thing that I neglected to mention in the intro is that you're also part of this COHA, this Clinical and Translational Science One Health Alliance. One Health has been a very interesting topic for our show, primarily on the infectious disease side of things. But this organization points out that One Health, when we look at sort of the connection between animal and human, of course, the environment, what have you, it's more than infectious diseases. Animals get cancer, animals get cardiovascular disease, diabetes, arthritis, and so forth. Talk a little bit more, if you would, about this theme of One Health and ultimately the connection, or sort of the connection to, again, comparative biology, that we're pretty similar when it gets to these larger animal species.
Yeah, and that's really where, we talk about translation as kind of being the bench to bedside, journey that things take from discovery to making a widespread global impact. But along that journey, there are a lot of different areas that we have, I think, traditionally neglected to pay attention to, which is that in addition to our own health, which is primarily what most of the major funding for health changes are in the world, there are these other creatures that share the planet with us, and they are also subject to the environmental, exposures and other things that we are, whether that be agricultural animals, or in the case of my work, companion animals that live in our homes that are experiencing not only our environmental exposures, but also even a lot of our lifestyle choices. So whether we're sedentary or active, whether we're smokers and they're inhaling our secondhand smoke, all of those things, and that there's this vast amount of knowledge that we can begin to tap into by paying attention to the health of those animals and the trajectory, even to the point where many of the animal species that we share our homes with really can act as sentinels for our own health and in our aging trajectory pathways to understand what's going to happen to us as we age. But, bringing that also two-way street backwards, which is we care about these creatures, right? Especially our companion animals. And we want them to have healthy, very vigorous lives like we do. And so the idea that this is a very two-way street is a really important thing. And in fact, in the work that we've done in the cancer field, a lot of our clinical trials that we do in our patients, our canine and feline patients that have naturally occurring cancer, owners can elect to enter a clinical trial where they're using a new therapeutic to treat that cancer. All the same ethical tripwires and boundaries exist in our human clinical trials as do in the animal clinical trials. And the concept for many pet owners that not only are they helping their own pet and other pets that may in the future have cancer like their pet, they're contributing to human cancer research or regenerative medicine research is a huge win for them. And for us, I mean, that's been a successful story that people are really engaged in this concept that there is one medicine, that this is all sort of the same thing, just repackaged, if you will, in different ways for dogs versus humans. And, there are all different aspects of this where we could kind of double click, like the regulatory processes and how our companion animals might be partially able to help us accelerate that and de-risk some of these, kind of higher risk type of drugs that we think might have very big impacts, but just are slow to come through the pipeline. So that's a rather long answer to your question.
No, it's awesome. And it feeds right into where I was going next, because, once again, thinking back to your work on, as you were talking about limb preservation, osteosarcoma at the beginning, okay, here's something where, you have to do the surgery, you have to deal with the cancer, but then you also have to deal with the regenerative medicine side of things. And another really interesting thing, again, as I was going through your portfolio, you have been sort of at the forefront of using not just experimenting or exploring some of these novel areas. You've published on things like extracellular vesicle-based therapeutics, but also combinations, synergistic combinations. You published on combining mesenchymal stem cells and PRP. Interesting work that you've done on FGH2, transforming growth factor beta 1, adipose stem cells, and I'm really, I'm extremely fond and interested in this principle of combinations, because it's something that we gloss over a little bit too often. Obviously, we know about combinations in HIV, in multi-drug cancer therapies, but it's one of those things we still have sort of a single magic bullet perspective a lot in sort of the pharma industry. Talk a little bit about some of these combination approaches that you've taken and some of the strategies that you used in the not just the oncology space, but some of the other companion animal work that you've been up to.
Right. And I think we all recognize that there are limits to any one kind of approach, and the complexities of, for example, tissue regeneration, or even, blocking drivers of aging and processes at the cellular level are much more complex than we really know. And as our understanding of cellular biology and pathways and what impacts expands, we start to realize that the needle in the haystack really doesn't exist, right? And what we need to do is think about, well, what are the tools that we do have that we know at least fundamentally work at the levels that we think are important, for example, cellular regeneration or aging, et cetera. And so I think that's really the thought, is that, we can not only discover sort of how things impact one another in combination, in some of these animal models, whether they be laboratory animal models or in naturally occurring disease states, that really in a sick animal, for example, some of these therapeutics that work really well in mice, or even in, larger animal models that, animals will tolerate, maybe they're not going to tolerate if they're ill with the very disease that we're trying to treat. And that's what oftentimes stops things in that regulatory process, is these toxicity issues that nobody saw coming. So I think that's a knife that cuts both ways, right? We need combinatorial approaches to a complex problem, and it makes sense that we would do that. Another piece that I wanted to touch on that I think is important too is that, one setting doesn't fit all. And our lab has been really interested in the concept of regenerative medicine in the setting of cancer and how the safety issues surrounding that. Because as you know, I've been working on bone regeneration as an example. Yep. And here we are having a patient that has a bone tumor, which has many of the same cell surface receptors that nascent bone cells or progenitor bone cells will have. So if we're asking bone to regenerate in a patient who previously had osteosarcoma and may have, microscopic disease circulating somewhere else in their body, or even locally in the original site, could we potentially do something really bad? Could we add fuel to the fire of the cancer in an attempt to do something good, which is to regenerate bone and save a limb? And so we've done a lot of work with what are the bounds in which you can use some of these regenerative approaches, whether they be single or combinations, in the setting of cancer safely and also effectively, because chemotherapy, for example, is targeting rapidly dividing cells. And now if we're asking tissue to regenerate, how does that influence, healing tissues? So in both ways, the combination of disease and setting and drug or therapeutic or approach, they all have to be thought of at the same time and together. And one of the things that's really wonderful about this transdisciplinary approach is that by bringing in the lens of expertise from different domains of research, we really can find, kind of the landmines that are a little bit hidden to us that are very narrowly focused in these certain areas and on mechanistic approaches and things, which is all necessary. But to make it to the next step, you really need that, transdisciplinary perspective that converges the knowledge of all these disciplines to really see the bigger picture. And I think that's really what I'm passionate about, is bringing those types of teams together. So your comment about it being important for us to think about this on a more, instead of a single approach basis, in a more complex way, whether that be additional combinations of drugs or the setting, the patient, the other aspects and the X factors that go into whether something's going to work in a patient. That is a very, very big piece of the puzzle that I think many scientists and maybe even many clinicians have kind of ignored up until now. And so I think it's a part of what we need to be focusing on as scientists in the future.
Yeah, and I also neglected to mention this article that you wrote called Synergy in Action, where you sort of go into the different pieces of and not just the medicines, but the different disciplines involved. So yeah, it's fascinating and spot on. I really appreciate your perspective on all that. Getting to sort of the combination condition of them all, aging. You gave this fascinating talk at the Healthy Aging Speaker Series. Overall, How Man's Best Friend Hold the Key to Changing Aging, and your presentation was entitled Great Danes and Granddads, Surprising News About Changing How We Age. And here you introduce, we talked a little about the hallmarks of aging on the show, but you introduced this extremely important period known as the translational gap, where we have mice and nematodes and yeast and all sorts of other great things, just like we have in a lot of different fields, but we need something there for the proper translation, because a lot of that stuff usually doesn't get it across. Here come man's best friend, the dogs. Talk a little bit about the translational gap and the important role you see dogs playing here for aging.
Right. Well, you described it really well, that the discovery, especially in the aging field, is piling up on one side of this great divide, and yet very few things have made it into a meaningful health impact in a human population. And there are a lot of reasons for that. One of which is kind of the traditional paradigm of, starting in very simple animals and then making your way up to a more complex animal like a mouse, and then expecting that to behave similarly in people. And mice are an incredible tool. And, of course, I do a lot of mouse research as well. But to get across the bridge, we need something that's going to be able to de-risk that or accelerate that process, such that we can mimic what might happen in a human population in a way that would allow us to understand, is this going to be successful in the setting of disease, older age, and the genetic and epigenetic heterogeneity that occurs in a normal human population as a result of our, actual genetic makeup, but also our environmental exposures and lifestyle choices and social economic status, et cetera. And so what animal model could we potentially look to for that? And the dog certainly comes up as, the naturally occurring aging model that lives right alongside of us in our homes, exposed to our environments and foods and water, et cetera. But in addition to that, the dog has one very unique, and it's pretty much unique in the entire animal kingdom, really, about it that makes it an extremely powerful tool for translational aging research, and that is the diversity of lifespan based on body size. So the reason that lecture is titled Great Danes and Granddads is because we all know, most people know, that Great Danes only have a very short life. They live to 7 or 8 years, whereas small breed dogs live very commonly to 15, sometimes 16, sometimes even 20 years. And so there's something about this body size diversity that really changes the aging trajectory And we know that on a cellular level, if you took a 9-year-old Great Dane and a 9-year-old, say, Jack Russell Terrier, and you were to compare the drivers of aging within their cells, they're exactly the same chronologic age, but inside their cells, the Great Dane has a lot more accumulated drivers of aging, and on a cellular or biologic basis, that dog is older, much older. And so that's an interesting combination, because we have the similar species, right? It's not like we're going across species. And we actually know when that Great Dane begins to accelerate its aging pathway relative to the small breeds. And interestingly, it happens at skeletal maturity. It happens when they become mature, that all of a sudden the Great Dane accelerates in rapid motion relative to a small breed dog. The thing is, we can't know that in a human population. We know that by the age of 85, 90, people tend to fall into two pretty divergent phenotypes, if you will. You're either really independent and out on the golf course 5 days a week, or you're maybe needing some assistance and on a lot of medications, maybe in a memory care unit or something. And there's not a lot of people in between. All we know is that between birth and the year 85-ish, they somewhere along that line, they began to diverge. If we are looking at longevity therapeutics that will change that role, will change the person on a less healthy aging pathway and try to divert them to a more healthy aging pathway, we need to know when they diverge, because that would be an opportunity to test these therapeutics that are now on this side of the divide, right? That we know work in reversing aging changes and slowing aging, the onset of aging diseases. We need to know, do we need to do that when they begin to diverge? Or is age 70 appropriate time? Will we have a big effect at age 80 as big of an effect if we started at age 50? But we can't really do that in people, because we don't know where they're going to end up. But we know where they're going to end up in dogs. We know that at age 9, that Great Dane is not going to be in great health. They're going to have a phenotype that's much older, is going to have more drivers of aging. And so if we can look at those animals in comparison and actually treat them at known time points along that divergent pathway, suddenly we have that answer, which we wouldn't have been able to find any other way. I mean, there's no laboratory animal that can mimic that same way. And I think that's one of the things that's also important about that translational gap, is that if we're talking about longevity therapeutics, we know that that's a hard road to go down, because we don't recognize age as a disease. So if you're trying to get regulatory approval for a longevity therapeutic in a human population, you really can't do it for lifespan. You'd have to do it for something a disease, a recognized disease, Alzheimer's disease, macular degeneration, whatever. But that is not a limitation in dogs. We can do that in dogs. And if it works in a population with naturally occurring disease, the same environmental drivers and exposures, the same lifestyle choices in many cases, and the epigenetic and genetic heterogeneity that mimics human populations, the likelihood that is going to work in a human population is so much greater than if we were trying to go from mouse to man. And unfortunately, I think a lot of the, scientists that are on study sections are really entrenched in that old kind of paradigm, and we need to shift the paradigm. And that's really where the bridge across the divide, the dog becomes a very powerful model for that.
And when you say dive down into the that hallmarks of aging chart, what are some of the things that this is not, the question isn't phrased the right way, but are there certain things in the hallmarks of aging that, when it comes to these companion dogs, that pop up sooner? We're a bird family, so I don't know much about dogs, but and obviously, if you have projects that you're involved in that you can't talk about, that's fine. But what are some of whether it's inflammation or stem cell exhaustion or any of those other components, what are some of the things that you do see in dogs manifesting earlier on in that cycle of life?
Yeah. I think it's been pretty well established that dogs experience stem cell exhaustion and stem cell depletion as they age. We see sarcopenia in dogs. frailty even in dogs, which is not as clinically, like it's not as robustly clinically measured as it is in older humans, but it's recognized in veterinary medicine. There's even a good paper that came out recently about frailty indices in dogs and mortality, like being a predictor of mortality as it is in people. So that type of sarcopenia, loss of strength, et cetera, that's a big one. And stem cells in muscle are an area of research of mine that are a fond area that I like to talk about, but I mean everywhere. And also senescence, cellular senescence. So we see that in the brains of dogs with cognitive decline. We know that dogs get canine cognitive decline that mimics Alzheimer's both structurally and biologically. And so we see senescence, for example, in the brains of those dogs, as well as, inflammation, low-grade inflammation. So those are some ones that we're very familiar with, and telomere shortening, and which is a marker. The other thing is nutrient dysregulation or nutrient sensing dysregulation, insulin-like growth factor aberrations, et cetera, that are part of some of the targets that people are working on now to sort of reverse that process. One of the things that we're working on is biomarkers. And so we're involved right now with developing a paired human dog biobank where we are sampling every year both the canine companion and the human living in the same home to look for aging biomarkers and to see if we see aging biomarkers accelerate or different aspects of whatever we are to discover in the future, as a biomarker of disease A, B, or C, or just aging, healthy aging versus less healthy aging. Do we see that in the companion animals living in the same household? And those people are being sampled on the same day at the same place. And so these are now a biobank that can be a very rich resource for both scientists and industry partners that are interested in developing both biomarker discovery and therapeutics for various diseases of aging, as well as other things that might occur during the animal's life. So the concept that we could, kind of look to the dog as our sentinel for, disease in our own individual health is another really interesting area that we're working on. I think I strayed from your original question, which is what?
No. That's I think that's fine. If you continue along those lines, because I know one of the things that's mentioned in the One Health materials is sort of the human-animal interaction component and the human-animal bond as part of health in both directions. Can you say a few words about that as well?
Right. Well, we know that in general, pet ownership is something that's good for longevity and good for healthy aging. A lot of that may have to do with emotional and social aspects. We know that part of what is involved in healthy aging, even cognitive aging, is to have community and to be active in many of those things. And pets allow that. They give us those opportunities. So we have to walk our dogs. We have to, go to the veterinarian. We're often more concerned about our animals' health and do a better job at being good stewards of our animals' health than we are of our own. And so just the idea that by caring for another being, whether that is a four-legged person or four-legged or a two-legged person, that we are actually benefiting from that relationship. So we know that pet ownership in itself is a healthy aging promoter. I imagine that there may be times where having a very misbehaved dog or having terrible allergies or other things that could be kind of negative aspects of our determinants of health outcomes are possible, but certainly on the whole, we know that that's the case. And so our goal really is to think about, yes, we are looking at, I'm involved with another project called the Colorado Longitudinal Study, and their work is sampling 1 million Coloradoans over a 10-year period. That's their goal. And working with them to look at social determinants of health outcomes and pet ownership as part of their, study, but also piggybacking the paired human canine biobank effort with that effort so that we can actually capture some of these things that over time in a prospective manner that we probably wouldn't be able to capture in any other way, understanding, the health aspects of pet ownership, whether that's as a sentinel for our own health or as a determinant of our own, social and mental health as we age.
Nicole, one of the things I wanted to ask about in terms, because you mentioned the aside from the normal care in your facility, there are also the opportunities for clinical studies. And I wanted to ask you a bit about this. And I had a friend of mine who I had on the show in the past. It was Ellen de Brabander, who she came out of animal health, but she was also in human health. And back in the day, I used to talk to her, and she used to say, I hate when people could come to me and think that animal health was easy or easier than the human side, because A, it's not, and B, you're bringing a patient, in this case, my Great Dane or Chihuahua, what it may be, that is beloved to the family, maybe more so than family members, but there's extreme care that needs to go in, not just to that animal, but in the case of a clinical trial, many factors come into play. Talk a little bit about the clinical trial component of this when it comes to companion animals, please.
Mm-hmm. And so the clinical trials that we get involved with at CSU, it was really started in the Cancer Center, and they really developed a very, very good infrastructure for clinical trials management, including GCP-like clinical trials, whether that be for an animal therapeutic or treatment, or ultimately for human use. And sometimes in parallel, like they might have a second lead molecule that they're interested in for a veterinary market, et cetera. But the way in which it's set up is that owners are, they come in to be treated for whatever the condition is, in the case of cancer or some age-related condition. And they're given all of the options that they can choose from in terms of treating that. And that's generally everything from something that's just very palliative, in the sense that just trying to make the animal more comfortable, but accepting progression of that disease, all the way to trying to stop or get rid of the disease completely, or at least give a very, very long remission in the case of cancer. And that's our standard of care. It's the kind of menu of options that people can choose from in veterinary medicine. And then they're also offered, if they're an animal that would be eligible for a particular clinical trial, they are offered clinical trials. And so that's typically when we come in and chat with them and say, here's kind of what we're looking at. And if you're interested, you could volunteer your pet. Here are, kind of the risks and the benefits to your pet. You always get standard of care plus. You never have to deny standard of care. It's part of our ethical, policy, is to not deny anybody standard of care. So if you are participating in a clinical trial, it's standard of care plus. And then we expect, we're going to need to see this pet this many times, et cetera, back to get our sampling and just see what's going on with disease progression. And at the end of that pet's life, we ask that you allow us to do an autopsy to understand what's happened in that animal's progression of disease. And certainly if there are any side effects from the treatment that we are now using as an experimental treatment, we will commit to treating those side effects to the best that we can. So, if there's something, for example, a chemotherapy that causes a very low blood count, white blood count, we're going to put them in our ICU, and they're going to get care just the same as any pet that came in that had a low white blood cell count, and we will take care of those costs. In addition to that, oftentimes there's some incentive to the client, and generally the incentive is to help pay for the care. So as you probably are aware, a lot of treatments, both for age-related diseases and cancer, which is an age-related disease, yep, are very expensive, and third-party payment is not standard in veterinary medicine. And so spending $10,000 to sometimes $20,000 on a pet's care is not that uncommon when we get into some of these advanced, medical situations, and people want to seek that advanced care. And so sometimes participating in a clinical trial offsets the costs of that, so that the people can proceed and maybe, and actually also contribute. And as I mentioned, I'm amazed at the number of pet owners that are really, really inspired by the fact that they are contributing. That their pet is the one that's contributing to not only other pets' health, but also human health. And that is something that people can feel good about and people get behind.
And continuing along that for a moment, because as I mentioned, per your portfolio, you've been touching on some of the cutting edge stuff in terms of the stem cells, in terms of the extracellular vesicles. What else is hot in terms of whether it's CAR T or gene therapy or X, Y, and Z that's coming down the pike that you're personally excited about, not just from the companion animal angle, but also in terms of the comparative biology?
Yeah, I think a lot of my excitement is coming now from sort of the better understanding of stem cells and their effects, and then what we can do that really won't involve the cells themselves. And I think we have an opportunity right now in these extracellular based therapeutics, we talked about that a little bit, to be really good stewards of this new kind of discovery and moving it through and translation, both for the benefit of pets as well as for the benefit of people. I think that's a very exciting area. I think the whole area of xenotherapeutics is extremely exciting, and I feel like that's really at the tip. That is really at the tipping point of what I think is probably going to end up being something that makes a meaningful health impact in both animals and people in the nearest future. And then on the cancer side, yes, CAR T is huge. I think that's a huge area. I do think that the induced pluripotential stem cell field, and using that not only for types of treatment of different diseases, but also from the standpoint of toxicity studies and other things to understand better how things work in a disease state. Because again, I feel like a lot of these, efficacy trials, or sorry, toxicity and in early preclinical data work in animals that don't necessarily have the disease and they're not sick. So really understanding what that's going to look like in a population of people or, pets that do have a disease is an important piece that I'm excited about in terms of that technology being a game changer for us in the field.
Cool. Nicole, before the show, you and I were chatting, and I was mentioning that when I went once again into PubMed, I found your very first publication ever was in ferrets and pancreatic cancer in ferrets, and it got me thinking about other species that may fit that translational gap model. Any other, we talked, we've talked about things like the naked mole rat on the show. We've talked about ground squirrels and hibernation and stuff like that. Any other interesting stories about animals we might not think of that fill that role that you may see come through in the practice?
Right. Well, I will tell you that the most common question I get when I talk about the Great Danes and granddads stuff is, what about the cat? What about, cats? Are they good models as well? And yes, they are. They don't have the benefit of having a different lifespan based on body size like the dog, but they are, again, live in our homes. So do our pet birds, by the way. And they are very sensitive environmental sentinels, as you know, to the old canary in the coal mine days. That was what was used. And so birds are extremely sensitive creatures to environmental drivers of health and translation. The other animals that come to mind are, creatures that have, this kind of the concept of Peto's paradox, right? You've probably heard of that before. Yep. That have many copies of cancer suppressor genes, often go hand in hand with a lower incidence of cancer in older age. And I think it's very interesting to me when you look at the hallmarks of aging, that little wheel that we're familiar with, and the hallmarks of cancer, and you superimpose those two things, you find 7 common areas between those hallmarks that are between cancer and aging. And we know age is the biggest risk factor for cancer, so that's not terribly surprising. But what's really kind of, I think, profound to me is that, it's that whole geroscience theory that by thinking about the drivers of aging as sort of the key, common thread between all the diseases of advanced age, that we have an opportunity to make a bigger impact. So going to those kinds of animals that we know have longevity aspects to them, despite their very large size and despite their long lifespan, natural lifespan, I think are going to be very important for our, our continued understanding of the whole picture.
Outstanding. Nicole, one last thing while I have you, I noticed in recent last year or so, you've published a few papers on COVID. Obviously, while not a disease of aging per se, disproportionately affecting the elderly population. Can you just say a few words about the time you spent on these papers? Because obviously you run the Center for Healthy Aging, and a little bit of your responsibility there as well.
Well, it's really, it's a one medicine story, actually. And so what happened early on in the pandemic is, as the director for the Center for Healthy Aging, I was newly hired. I'd only been in the position for several months. I was creating relationships with different senior residency communities in the area, in the northern Colorado and along the Front Range area. As a means to develop registries and participation for human clinical trials. And so, we have the veterinary school that does great animal clinical trials with animal patients. And then we have the Center for Healthy Aging is really set up as a human clinical trials center for aging therapeutics and other age-related diseases and interventions. And so that was my goal in developing these relationships. Then COVID hit, and as a veterinarian, I am, and many others, were sort of puzzled by the fact that the testing that was available was only available for people that were hospitalized. You recall that the CDC had put out the only FDA-approved test that you could use, and there was limited numbers, and it was flawed, and what was available could only be used for very sick patients. And I am not a herd medicine person. I'm not like a agricultural medicine person, but even just based on my own training as a veterinarian, I started thinking, like, this is a really odd way to approach this public health threat. In a way, like if this were a foreign animal disease outbreak in a herd of, say, food animals, we would not waste our very limited resources testing the sick. We would isolate the sick, and we would test the well, because we need to know who's the carrier and when is it safe to bring new animals into the herd, for example. And so when I thought about that from the perspective of a public health threat, and here I was, like, having relationships with these people in these senior residential care communities, assisted living and nursing homes, and they were terrified, and they had no resources. There was no PPE, there was no testing, and these are the most vulnerable people. And so I was speaking to a very good colleague of mine. His name is Greg Ebel. He's a virologist. And I said, what does this make sense? I mean, why are we not doing surveillance testing on the people that are, coming in and working with the most vulnerable population? This doesn't make any sense. And we said, well, this is PCR. This is not rocket science. Let's go ahead and develop our, the primers to detect the virus. We can do that. And under a research, umbrella, can we actually test staff that are coming in from the community to work in these settings and see if anybody is a carrier? Because once it gets in these facilities, it's going to be like wildfire. And sure enough, what we did, we were able to do that. And we had 5 pilot facilities. 15% of people were positive, no symptoms. And at the time, remember, screening was for fever, cough, and travel history. That was it. And yet here they were. And then there was the argument, well, they're probably not transmitting if they're asymptomatic. Well, we did plaque assays on all of those nasal swabs, and we could show that they were highly infectious to others. And we brought that attention. It was a very odd, one of these synergy moments where I had an opportunity to speak to the governor of Colorado because of my relationship with the senior aging community, the senior care community. And I presented this work to him, and he really paid attention. And so that led to about a $20 million grant from the Department of Health to study surveillance in staff and residents within nursing homes, that later got the attention of Washington and became statewide and then eventually nationally. And that's what we published on, not only just the incidents and the ability that if we were actually able to identify those people early and isolate them, we could mitigate outbreaks and save lives, but also the viral evolution in these people who are, generally immune suppressed because of their older age or other comorbidities, and how that begins to, change and evolve within these, very vulnerable populations. And so again, it's a one medicine story, because it was my perspective as a veterinarian that really made us do this research that then caused this discovery to be that these are asymptomatic carriers, and they're highly infectious, and they're coming to work to take care of people that they really care about, and they can't protect them, and they can't protect themselves. So one of those strange convergences of different disciplines that came together to make an impact.
No, I appreciate you sharing that. And as I said, I wanted to, again, I thought that was an important piece of your overall portfolio, and we really wanted to highlight it. But so thank you for that. Nicole, anything else hot for 2022? Any conferences you're going to be presenting at, places we can listen to, meet you? Anything else happening that I missed that, please take the floor.
Oh, thanks. If you're in the veterinary world, I'll be in Nice, France in September at the
Nice.
European Society of Veterinary Orthopedics and Traumatology. I'll also be attending the Gordon Conference on the Biology of Aging in Europe this year. So those are the two biggies. And then I'm usually at the Orthopedic Research Society meetings, but there's always an opportunity to reach out through CSU's website. And I would love to hear from people that are interested in collaborating, that are interested in, adding synergy to our paired human dog biobank, or users of something like that, our EV-based therapeutics work, all of those things. If there's one thing that defines, I think, our, ethos, it's collaboration and synergy. And so I hope that your listeners will reach out, because we'd love to hear from you. For sure.
Absolutely. And we'll definitely help spread that message. Synergy in action.
Yes.
I love it. Really, really great stuff, Nicole. I got to keep following you, rooting you on all these projects. It's just as you say, a fascinating combinatorial set of programs you have. For everybody that is going to be listening to this particular episode of our show on the various podcast networks, or watching on our YouTube channel, again, you've been listening to Dr. Nicole Ehrhart, Director, Columbine Health System Center for Healthy Aging, Colorado State University. Nicole, I want to thank you for taking the time out of your schedule to come talk to us for a little while about all these topics. Obviously, thank you for everything you're doing, both for humans and companion animals. And as we like to say on our show, thanks for helping to create a better tomorrow for humans and companion animals via what you're doing. Really very exciting set of projects.
Well, thank you for giving me the voice. I really appreciate it.
Right. Great seeing you.